Madam President, last year has been a challenging time for our state and our country. The novel coronavirus from the Hunan province of China, COVID-19, has taken thousands of lives and made many more sick. At the same time, COVID-19 has been the most politicized disease in human history. The pandemic was used as an example, as an excuse for judges and politicians to ignore long-standing election integrity laws, which cast a doubt on public confidence in our elections and our institutions. But what has gained the most attention, Madam President, and profoundly affected the lives of citizens throughout our country have been the many extreme and far-reaching health orders from all levels of government. COVID-19 is an infection with a 99.7% survival rate. For those under 70, the survival rate is 99.95%. But rather than protecting those truly at risk from this dread disease, the elderly, those with pre-existing conditions, those in long-term care, too many health officials have adopted a draconian approach and issued orders that have shuttered businesses, caused people to lose their jobs, interfered with religious worship, delayed diagnosis and treatment of serious diseases, resulted in loss of months of educational attainment among our students, and increased levels of substance abuse, depression, and suicide. Our young people, who have a rate of complications and death from COVID-19 of approaching 0, have been especially hard hit, with 25% of young people contemplating suicide during this pandemic. To add insult to injury, Madam President, in at least one jurisdiction in our state, a county executive has waged war against small business owners and their employees, the restaurant industry. Many have questioned, is the cure worse than the disease? There is, of course, a role for public health professionals. The Office of Public Health Officer was enabled by statute in Missouri in 1948. But the legislators who served in these halls in 1948 could scarcely have imagined the far-reaching, arbitrary, and often hypocritical actions done in the name of public health over the last year. Examples abound, but include shutting down churches when other gatherings of the same size were allowed. And this is not confined to our major metropolitan areas. In our committee, several members of the committee noted that in counties in their districts, even drive-through services were sometimes banned. In St. Louis County, one county executive shut down outdoor school sports, except the one his son participated in. The same county executive shut down St. Louis County restaurants, and at the same time crossed the river to St. Charles County to eat at a restaurant. In Springfield, a local order required a Walmart and other realtors to placard items that could not be sold because of COVID. These items included camping supplies. I mean, during a pandemic, you wouldn't want anyone to go out and get fresh air. Our public health officials have had broad power in the name of public health on a wide variety of issues. This might include temporarily shutting down a restaurant because of an outbreak of hepatitis A or salmonella. They've issued health orders after tornadoes and floods. They've distributed vaccines. They've treated STDs and other diseases. But in our system of government, Madam President, we did not intend to make them absolute dictators. Do they, for a respiratory virus with a 99.8% survival rate, have an absolute right to shut down churches and small businesses? Tell us who can visit us in the hospital after our wives or have had a baby. Who can celebrate Christmas or the high holy days with us in our homes? And even if your answer to all these questions is yes, are there any limits to their newfound powers? Where does this all end? Do our health officials have the power to close down McDonald's in the name of public health? Or ban the sale of trans fats or high fructose corn syrup? Maybe ban smoking in our homes? What about implementing Dr. Fauci's idea of a ban on Thanksgiving or Christmas or handshakes? Maybe some health official will decide that climate change is a public health crisis and take it upon himself to close down our highways or our trucking industry or maybe the Labadie power plant. And there has been a very arbitrary, even vindictive element to the shutdowns in St. Louis County. For reasons that make little sense, County Executive Sam Page and his Health Director Emily Doucet have focused their wrath on restaurants. On October 10th, Dr. Alex Garza of the St. Louis County Pandemic Task Force questioned the point of shutting down restaurants. Quote, "Even if we shut down restaurants and bars, I don't know how much of an impact it would make on transmission because there is already so much of it out in the community." Nevertheless, while Page and Doucet impose draconian restrictions on restaurants, they allow, according to one of their orders, quote, "entertainment and attraction venues, concert venues, commercial and professional sporting events, museums and casinos," close quote, "to submit plans for approved operations." Even Governor Andrew Cuomo on February 8th announced plans for reopening New York City restaurants. And even apart from the restaurant closure, there is very little evidence that shutdowns work. Some of the highest COVID case and mortality rates in the country and in the world have occurred in shutdown states like New York, New Jersey, and California, while less restrictive states like Florida and Texas have fared better. St. Charles County, which opened up in early May when the governor lifted public health restrictions, has half the COVID mortality rate of Page and Doucet's St. Louis County. Stanford professors of medicine Jay Bhattacharya and John Ioannidis in January published a very important paper in the European Journal of Clinical Investigation entitled "Assessing Mandatory Stay-at-Home Orders and Business Closure Effects on the Spread of COVID-19." When comparing 10 countries with lockdowns, including England, France, Germany, and the United States, with 2 countries that resisted lockdowns, Sweden and South Korea, they found no benefit of lockdowns. Meanwhile, lockdowns have devastated economic, educational, and public health systems. In this pandemic, bureaucrats have too often taken an extreme myopic focus on COVID case numbers and not taken into account the costs of their action. And far too many of them have appreciated the limits of their power in a democratic republic. Needless to say, this topic has been the subject of intense interest here in the General Assembly. This bill is a combination of 7 bills heard in the Health and Pensions Committee, filed by 6 senators. What does this cover? First, several of these bills, including my own, bar the state or any political subdivision from putting any greater restriction on the free exercise of religion than any other service or meeting. This would appear to be a simple common sense application of the First Amendment, but it has been extensively litigated, including several times to the U.S. Supreme Court. Governors in California, New Jersey, and New York have been very aggressive in shutting down churches. Thankfully, the U.S. Supreme Court has sided with the cause of religious liberty in the First Amendment in the cases of Roman Catholic Diocese of Brooklyn v. Cuomo and South Bay Pentecostal Church v. Newsom, upholding the First Amendment right of freedom to worship. As Judge Gorsuch put it in his majority opinion, it is time, past time, to make it clear that while the pandemic poses many grave challenges, there is no world in which the Constitution tolerates color-coded executive edicts that reopen liquor stores and bike shops, but shutter churches, synagogues, and mosques. The substitute prohibits public health orders from restricting freedom of religious worship. Other of these bills, including the senator from Cass and the senator from the 15th, make it clear that no, Dr. Fauci, you cannot tell us who can visit us in our private homes. This legislation protects the ability to gather in one's home. All 6 senators, the senator from the 15th, the senator of the 8th, the senator from Shelby, the senator from Jackson, and the senator from Cass, whose bills were heard in Health and Pensions, in various ways address the issue of how county health orders are promulgated and what political accountability, accountability will there be to elected representatives regarding these decrees. we need to be very careful, I would argue very restrictive, regarding destructive shutdown orders we have seen during this pandemic. A year into this pandemic, it is clear that shutdowns do not work and have done more harm than good. This bill would prohibit political subdivisions from issuing public health orders that close businesses, churches, or other places of public gathering for longer than 15 days in a 180-day period, unless authorized by for a second period for an additional 15 days upon a 2/3 vote of the political subdivision's governing body, for a third period of 7 days, and again by a 2/3 vote, and a fourth period of 7 days, again by a 2/3 vote. The initial order does not get a 15-day free pass, however. The governing body can reject it immediately. Further shutdowns would require the approval of the General Assembly. This system of approval of closure orders recognize that at some time, theoretically, there may be a time when public health officials need to act quickly in order a closure for public health reasons. But that order should be approved by the governing body very soon, or should expire soon thereafter. And there should be a strong consensus of the governing body, and hence the requirement of the 2/3 vote. At the same time, it should not go on forever. If the governing body doesn't vote to keep it, it should expire. And while the approval of the General Assembly seems like a very high hurdle, it is intentionally so. Remember, the 4 periods together add up to 44 days. The General Assembly has often convened with a week's notice or less. And if there is a pressing need for quicker action, the governor has emergency powers under Chapter 44. Language from the senator from the 15th protects parental rights and the rights of fathers to visit new mothers in the hospital after their children are born. Language from the senator from the 15th also makes it clear that a parent will not be required to quarantine from his or her own family. The senator from the 15th also has language allowing for a partial property tax credit in the event of loss of a business shutdown. Finally, it requires candidates for county health boards of trustees to actually run for election. We want to get this right. We want to be able to respond quickly and effectively to the next public health crisis. But we also can and we must restore the balance of power that is inherent in our system of constitutional government.